Good morning, everyone. Welcome to Breakout Session 1B. It's about life, cardiac rehab, and self management. I'm excited to introduce our three guests: HeartLife champion Bonnie Catlin, exercise specialist Gordon Fogg, and person with lived experience, my good friend Sunny Tutt. Take it away, you three. Enjoy, everyone.
Hi, everybody. Good morning and welcome to our session on It's About Life, cardiac rehab, and self-management. And the outline for our session is how the importance of self-management. We're going to review some of the heart failure patient self-management resources. Gord's going to talk to specifically the rehab piece. And then the majority of this session is going to be about Sunny's personal self-management journey and from diagnosis until now. And that will be the majority of this session. So as you all know, the goal of heart failure management is to confirm the diagnosis. And then once that's confirmed, to slow its progression. We want to keep you out of the hospital and we want to improve mortality rates. So there are 4 key factors to achieving this goal. And the one we're going to focus on in this session is the self-management strategies. So as you all know, heart failure is a chronic progressive condition that at times has really high symptom burden. And there's no cure, but you can live for many years if it's managed well. So managing heart failure has evolved over the years. And in the 80s and 90s, it was all about telling our patients what they needed to do, making sure that they adhered to everything. It was really about a power over. But we've really come a long way since then. And we've shifted to more around self-management education. The 20th century is much better. And we've gone to more looking at principles of self-management. There's 7. And we really try to work with our patients and ensure that they have the knowledge about their condition. And it's a shared way of creating a treatment plan. It's not about the healthcare professional telling the patient what their treatment plan should be. So we actively share in decision-making and we monitor and manage signs and symptoms. So patients need to know how to do that, what's important about signs and symptoms, what isn't, and when to call for extra help. And then they need to be able to manage an impact of the condition on their physical, emotional, and social life. And this is a really big change over the years because, as Sunny will know, it was all about the physical piece of heart failure, probably when you were first diagnosed when you were 18. And now it's about the triad. It's about the social, the physical, emotional. And emotional is a big piece about it. And I know that Sunny will speak to a lot of that during this session. And then about adopting lifestyles that promote health, and then to have confidence to access the ability to use the support services. So Sunny, do you want to share a little bit of your story about when you were first diagnosed, how these principles were in the beginning and how they've helped you evolve to where you are now? Because I know that you do really self-manage your condition very well.
Well, first off, I'm a 18-year heart failure survivor. So I was diagnosed when I was 18 years old, and that was in the early 2000s. So how you're speaking of transitioning from the 80s and 90s and now into the 20th century, then I think I was just kind of at the borderline there in the early 2000s. I was diagnosed. So in the beginning, it was kind of getting a harsh reality, especially being at 18, being struck down at my prime, where I felt like 18 when you're invincible. So the concept of just understanding my diagnosis and just being from a healthy young man now, just barely being able to speak, put sentences together, barely move and walk upstairs or just do anything. So understanding it and also the compliance in the beginning. So I know you're affected mentally, emotionally, and so all those facets combined make it very difficult. For me at the time, it was very difficult to understand. So now I've evolved now into going an 18-year journey, going from different bouts of levels of heart failure, having LVAD, and even now post-transplant, where all this experience now has allowed me to utilize all the tools and now being self-managed. And I'm able to use the self-management tools that I can to the position where I am now.
Perfect. So the self-management tools that Sunny is talking about, we have 5 key ones, and all of you are well aware of these. And we're going to just quickly go over these, but Sunny's going to speak more to his personal experience and how he's been able to use all of these tools to live a really well-rounded, well life over the last 18 years. So as you all know, daily weights is important. And in a perfect world, you should be doing them every day. And there's lots of reasons around that. And we'll speak to that as we go through this session. All of you know the importance of not eating a lot of salt and trying as best as you can to keep it under 2,000 milligrams. Fluid intake is important for some heart failure patients, and the recommendation is trying to keep it under 2 liters. And then exercise and activity, which Gord will speak to in detail. And then the last piece is around medication and the treatment regime. And then our heart zones. This is your personal action plan. So daily weights, as you know, should be done every day as soon as you wake up, and usually with the same scale, wearing the same clothes. And one thing that we really teach our patients, which Sunny is well aware of, is that if you gain more than 2 pounds in 2 days or 5 pounds in a week, that's a big red flag that you need to either take an extra piece of Lasix or you need to call your healthcare provider because you are not doing as well as what you should be. So Sunny, can you speak to some of your experiences managing your weight and how that's been for you over the last 18 years?
So in the beginning, I'd say the first few years, this was a very difficult task to do. Um, Combined with the fluid restriction of 1.5 liters, it was literally impossible for me.
Yeah.
Um, and my weight would fluctuate. And me being, I was playing football, so I was in the high 200 pounds. I was 280 pounds offensive lineman. So when I was diagnosed, I had jumped up to over 300. And I think when I first got into hospital and got diagnosed, they took off almost 30 pounds of fluid off my body. And after that, like I said, combined with the compliance issues, not understanding it, and dealing with the acceptance of the disease, um, it was kind of hard to follow the regimen and even just grasping the concept of weighing yourself, taking Lasix, and managing. But
Yeah.
those days are past me. I know I remember being at an appointment one day, and they're like, "Sonny, you've got like easily extra 6-7 liters of fluid in your body," and I think that's just when I was 19 and diagnosed. I think a night before my appointment, night before, I went out for beers with my friends and probably had 4 or 5 beers. You know what I mean? But that's the old me from like 17 years ago.
Yeah.
These days now, I'm weighing myself even in the morning and at night to see what the fluctuation is during the day. So weighing yourself daily. And I know we're not traveling now in COVID, but even when you're traveling, I know it's hard to have a scale around. So just being cognizant of just watching out for symptoms like if there's any, kind of bloating in your gut or swelling in your ankles, and then just monitoring your input and output generally when you're on vacation. And you got to keep watching out for the high sodium intake when you're eating out.
Wow. You get it.
Yes.
I would have liked to have had a conversation with you when you were 18. So like Sunny said, fluid restriction, try to keep it under 2 liters. And I know this is hard, as Sunny has said, and he did talk about how he does that. But sometimes patients do get confused about really what constitutes fluid. So this is a slide that kind of shows that it's anything that's liquid at room temperature, which does make it a lot simpler if you just talk about it from that perspective. Some tips on how to reduce thirst, because if you are restricting your fluid to your mouth does get dry, you do get thirsty. Some of the things that we recommend are brushing your teeth often, chewing gum, using mouthwash that doesn't contain alcohol. You can freeze grapes or any sort of fruit and suck on them. Use a smaller glass, sip fluid, and like Sunny did mention, you really need to measure and watch what you're taking in and out. But Sunny, do you have any other tips for the audience on how you reduce your fluid intake?
So in my drinks, I have I use lots of ice, and then sometimes to avoid getting a refill, I will just kind of chew the ice that's left over my glass. And most of my meals and everything I have at home. So I try to use the same type of glass that I have, and I already know roughly how many milliliters that is. So I'm able to kind of mentally track just the number of glasses then versus who has the time to, pour it in a measuring cup and then consume it and pour back in your glass, right? So just keeping a mental tally. And then like I'm going to demonstrate now, a little bit of chapstick helps.
Exactly.
Yeah.
And sodium restriction is a big thing. And I think this is one of the hardest things for our heart failure patient, because 2,000 milligrams, as we all know, is not a lot. And it's one thing to ask our patients to keep it under 200 milligrams, but the reality of it is that it's very difficult. And I know, Sunny, you have some experiences with that and some tips for our audience, and what your thoughts are around your choices for low sodium and how you deal with that.
So I got to say, first of all, to put it bluntly, 2,000 is very, very difficult to attain every day, keeping 2,000 or below. I think just you can't be too hard on yourselves. You should try to eat home cooked meals as much as possible, but I know a lot of people are on maybe a limited kind of budget for groceries, or they're working long hours and it's hard to have home cooked meals all the time. So I would say just keep cognizant of how much you're eating out or foods that are canned or preserved, and try to eat more vegetables and fruits, incorporate it and balance it. And then for sodium, I mean, I would say just try to keep at least below 2,800. I know 2,300 to 2,000, it's very difficult. I know my wife and we have our own herb garden, so we try to use our own alternatives to make foods more delicious. So and not everybody has the real estate for our own private garden, so we just have even a small planter like in our back rear patio area, and we just have our own thyme, rosemary, and other herbs that we just kind of grow and we use when we cook our food, prepare our food.
Perfect. So this is our food label. It does tell you how much salt is in each canned food or packaged food or anything that you're eating. It's important to check the amount of salt. It's important to check the portions. And like Sunny said, herbs and spices are a good replacement for salt. Mrs. Dash, one thing we do recommend though is you try to stay away from salt substitutes, because they are high in potassium, and that's actually not good for you either. So this is the heart zones. It's sort of your action plan that should guide your everyday sort of management of your heart failure. Every day, check your weight. Remind yourself about keeping your sodium below 2,000, making sure you got proper activity. You check, like Sunny said, if you're gaining weight, your feet are going to swell, your hands are going to swell, your shoes are going to get tighter. So it's stuff like that, so that you can actually assess your own self, and then your triggers. If you're in the green safe zone, that's great. If you're starting to gain a bit of weight, there's some direction on what you should do. And then if you're getting into the red zone, that's when you need to be calling for some help. So I'm going to pass it over to Gord, our exercise specialist, and he's going to walk through the importance of activity and exercise when you have heart failure.
Thanks for that, Bonnie. So I'm going to be speaking to rehabilitation and physical activity. I mean, just to be blunt and to start off, the pandemic sucks. It's hard on everybody. And for many people, it's been very disruptive to our routines, our physical activity habits, and it's been quite challenging for a motivation. So we'll try to give you some pointers, but I do wonder how Sunny, for example, what have you been doing to adapt and keep active throughout the course of the pandemic?
The pandemic does suck, and it's been difficult, I gotta say, especially in the colder months. It has been. I'm used to going to like my local gym. I was actually excited to use a new gym in the new neighborhood I moved into, the Grandview Aquatic Center, and it's got an amazing facility. And literally, I got my membership, and a week later, the pandemic happened, and I only got to go once. So I was very deterred, and I gotta say, early in last year, after March, honestly wasn't doing a lot. I know a lot of people can be affected emotionally from it, but it's okay. It's okay to feel down and want, a little bit, and stay in and not go. But eventually I kind of found a way, especially when the weather started warming up. My wife and I found a way to just get out and at least just move. We discovered local parks, went and done some forest walks, and just explored different areas. And I think that really encouraged us to get moving and keep active.
Excellent. Thank you for sharing that. So it's important as well to be able to differentiate between physical activity and exercise. Oftentimes, especially recently after diagnosis, exercise is kind of the scary word. So we often speak more about this concept of physical activity, which is really just any waking movement that uses your muscles and gets your heart rate up even just a little bit. And it can be light intensity for some people. That may be just doing dishes and tidying up. For other folks, maybe that's getting into a moderate activity or even vigorous for some, depending on your symptoms. But it's important to try to optimize and maximize your physical activity throughout the day, as long as you're not getting too fatigued. And the planned and structured piece of exercise is sort of the important part in terms of your behavior. A lot of folks worry about physical activity or planned physical activity being exercise, being safe. And for the vast majority of people, the answer is yes. Certainly doing some light or moderate intensity physical activity is quite safe and generally a low risk activity. But for some folks, particularly if you're interested in pushing things a little bit or doing certain types of things like weightlifting and things, then it may be valuable to chat with your doctor or your care team to make sure that you don't have any conditions that could put you at increased risk of harm. And so in terms of what this moderate intensity physical activity is, you can kind of assess yourself. If you're working hard enough that you're getting really out of breath, that's getting into this vigorous intensity zone. You're pushing kind of maybe more than you really need to see a health benefit. We talk about moderate as meaning kind of a 3 or a 4 out of 10 on a 1 to 10 scale. And the way you can check is by asking yourself, are you able to complete a full sentence without having to take a deep breath in the middle between words? If you're able to do that, then you're not in vigorous. And you should be kind of working hard enough that if you were to try singing a song, you wouldn't be able to do so without taking a bit of a breath. And this is kind of what we mean when we say don't overdo it. If you're noticing, if you have arthritis, that your joints are acting up the next day, or if you're getting out of breath, if you're really chronically fatigued, the evidence is pretty clear that one of the main benefits of physical activity is quality of life, and with rehab reducing hospitalizations. So there's no benefit to doing physical activity if it's really diminishing your quality of life. We want to emphasize that quality of life importance. Ideally, we would be accomplishing about 150 minutes cumulatively. So add it up throughout the week. And you can do that. There's no minimum. This was a recent change in the past year or two. 2 minutes, 5 minutes, 10 minutes, whatever you tolerate. You're allowed to take breaks with, as often as you need to, but try to gradually push things a little bit further in terms of what you're able to do now, but also remain focused on what you are able to do right now, and use that information to set some goals and objectives. Resistance training is another challenge. And the guidelines also recommend doing some resistance training a couple of times a week for most major muscle groups. As Sunny kind of alluded to, not having access to gyms is hard. So even going for a walk is, just as important as many other things. So if you have some resistance tubing or things like that at home, you may be able to get creative with some household items. But if you can fit that in, excellent. Stretching. Remember to stretch periodically from time to time. And this all really boils down to this notion of move more, sit less, Getting started can be a challenge. And the important thing, though, is to just get started. Really anything, any little bit that you do, and whether it's walking up and down your hallway, especially for folks who might be using a walker, even just walking from the parking lot to a store a little bit further, those little things do start to add up, especially if it's a little bit of a challenge for you. And you can, again, gradually over time start to increase those, how far you're able to go, and take breaks as you need. So in terms of staying motivated, it's important to set what we call SMART goals that are specific, measurable, attainable, realistic, and time-bound. So goals that give you a bit of a plan. I'll do 10 minutes of walking tomorrow morning is a little bit more specific than I should exercise, or I'd like to be healthier. It gives you a bit of an action item. Logging and tracking your physical activity can be a huge benefit. So we definitely encourage using either a Fitbit, an activity monitor, things like that. And then also using that information to set goals for yourself in terms of how quickly you can progress. And that gives you a little bit of a pat on the back when you do accomplish something. And we need that kind of reinforcement and that flood of happy juices coming to the brain. Really, we're terrible at long-term planning as humans. So we need kind of some sort of positive reinforcement in order to make behaviors stick. And I think chatting with Sunny, you had mentioned that you have an activity tracker or a Fitbit.
Yes, I have a Fitbit, and I would just track my steps. So it also goes in very detailed modes. It'll show like your tracking of the past week, the month. Sometimes it's very, very analytical, and it'll even compare to last year, and it'll even give you comments sometimes. Hey, you were doing more last year by this many steps, and then it could encourage you to do more. So that's what I use. I think I find that to be very helpful in kind of tracking my activity.
Excellent. And of course, with the pandemic, it's important to find creative ways to stay active at home, particularly with fluctuating or changing public health orders. So some resources that we'll post in a list sort of at the end include many fitness organizations or gyms have published free content that's available online. If you can ask yourself if you have any fitness equipment at home, maybe it's buried in the basement or hiding in a room under a pile of laundry as a drying rack. You might be able to dig those out, whether it's resistance bands or an old bike or treadmill. Or again, you can get creative a little bit. When the pandemic started, I was using bags of dog food as weights to work out. You can use a water bottle, anything like that. But really, as Sunny kind of mentioned, there are a lot of benefits to physical activity, even outside of just the physical health benefits, getting out and experiencing some nature, just getting outside of the house when we're being told to stay at home, trying to find ways to make things enjoyable and fun, and just incorporate activities that involve movement into your day-to-day life. That's really the trick to staying active and incorporating some physical activity and exercise and getting some of the health benefits from that. So I'll pass it back over to Bonnie, and we'll move on with some of the medication-related discussion.
So thanks, Gord. And then the final factor around self-management, of course, is medications. And as you all know, if you don't take your medications, they're not going to work and you're not going to get better. And so we really stress that you take your medications, and because they prevent hospitalization, they improve symptoms, they slow the progression of heart failure, they decrease mortality, and the biggest piece is they do improve quality of life. And that's why we really stress to take your medications. And I know there's a lot of side effects with some of these medications, and we're going to speak to some strategies when you do have side effects, what you can do, and Sunny definitely will have some recommendations for you guys on what you need to do. So the Cornerstone therapy beta blockers. ARNI is the new kid on the block, kind of works similar to an ACE inhibitor or an ARB. And then aldosterone antagonists, and even more, a more new kid on the block is the Sgl2 inhibitors, and we'll speak a little bit to that. And then there are other ones that our heart failure patients do take, digoxin and diuretics. So beta blockers, as we know, they reduce your blood pressure, your heart rate, so your heart doesn't have to work as fast and as hard. And there are some pretty significant side effects when you first get on these medications. And Sunny, do you want to speak to some of these side effects that you've experienced and some strategies on how you've been able to alleviate the side effects or even deal with the side effects?
Sure. I'm not on beta blockers and some of these medications now. I take a different assortment now in post-transplant, but from what I remember, it was very difficult in terms of everyday living and management, feeling tired all the time, lightheaded, and sometimes even shortness of breath. And your heart rate is also kept lower, blood pressure is low, and combined, then you would I would have to be careful from getting in a seated position, standing up, or getting out of bed, and just being very careful. And just taking your time with things. And I tried to exercise just like a daily regimen of taking afternoon naps, especially from being so weak, and then to recharge myself and try to kind of conserve energy again and feeling more energetic in the evenings.
Great. So this group of 3 medications, like I said, they do kind of, all 3 of them have the same end goal. They want to reduce your blood pressure. That helps to protect your heart and your kidneys. All 3 of these work a little bit differently chemically within your cells, but ARNI is the latest one. Some of you know it as Entresto. The really interesting thing about this medication is it actually is a combination of a ARB and sacubitril, and all 3 of them have similar side effects. And I know, Sunny, you've had experiences with these medications. So some of the big side effects, and they're similar to the beta blockers. So you get this overlaying of these similar symptoms. So the dizziness, the lightheadedness. Yeah, these also can affect your potassium and your creatinine. And the ACE inhibitor can cause cough. Some people have allergic reactions to this where they get puffy and swelling. And Sunny, do you want to speak a bit to these on your experience with these medications and the things that you've done to try to alleviate the symptoms or deal with the symptoms?
Yes, you brought up the issue with cough. So actually, early in my diagnosis, I was on a prescribed medication called Acupril, and upon taking that, I think a short time after, I developed a cough. And I mean, we've all had a cough at some point in our lives. So I thought, okay, it's just a typical cough. But my cough, and it developed into a very dry, repetitive cough. It affected me all day long, all night long. And I think it went on for almost 2-3 weeks, almost a month. So finally, when my next checkup came, I kind of complained to him about it because my GP just was prescribing take over-the-counter cough medication and stuff. And, unfortunately, my GP at that time, maybe it was out of his depth to kind of guess what could be the issue. And then my transplant clinic told me that, it's a common side effect of Acupril. So I encourage people, like, just when you have an issue, it's repetitive, or it's really bothering you, just speak up right away and contact your clinic. And in terms of other issues, like, about keeping an eye on your levels of like creatinine and everything, I would recommend just when the clinic tells you, hey, you have a standing order for blood work and to get blood work done, either monthly or quarterly, biweekly, I would keep on that schedule, because then they can tweak your medications, watching all those levels that are in your blood.
Perfect. Thanks, Sunny. One thing about the ARNI, the Entresto, is you don't get the cough. And so most of our patients, if they meet the criteria for an ARNI, we actually try to put them on first before the ACE or the ARB. Some people can't tolerate it, but so you will see that more heart failure patients are going on the ARNI. The new kid on the block, Sgl2 inhibitors. These are very new medication. Some of you, or most of you, may not even be on these. They were discovered in a diabetic trial. and they were discovered that they actually reduce all cardiovascular outcomes like death, hospital readmission with patients that have reduced ejection fraction. So they've come into our medication regime. There's been a bunch of new trials specifically for heart failure patients that have really shown the benefits. So your practitioners probably will be starting you on these if you meet the criteria to be on them. They do lower the blood pressure. They do cause dizziness, and there are some issues with your kidneys when you're on these, but they're it's a great drug. And Sunny, I think you and I talked about this. Are you on this medication?
No, I'm not on this medication. I've never taken this one before, but I really from seeing the benefits of it and seeing it now, like I wish it was available around my time.
Okay, thanks. So diuretics, I'm sure you guys feel like this just after you take them. And I've had many patients say that to me is, oh my God, I gotta go. But diuretics are great when you take them properly and when you take them at the right time of the day. And if you don't, then this happens, like what's happened to this poor elephant. They have not been shown to reduce hospitalizations or survival, but where these medications work really well is they improve your symptoms, and they improve it by getting rid of the fluid in your body. And in a perfect world with a heart failure patient, we're trying to keep them off diuretics. But as you know, sometimes that's just not an option. And Sunny, I know that you were on diuretics a lot and you're back on them. So maybe you can talk to some of the side effects and what you do to alleviate them and how you kind of manage your day to prevent what happened to the elephant.
Yes, I know definitely learning. It was a learning experience at Lasix the first few years when I was on it, and there have been times where I had to pull over on the highway because I couldn't hold any longer and had to just pee into the wind, and cars going flying by. But my my experience now has allowed me to kind of plan ahead. Just like right now, we're here and we're presenting live to all of you in the audience. I skipped my Lasix this morning. And I will take it immediately after because I'd hate to get up in the middle of this presentation and interrupt everybody. So, planning is key. And talk to your doctors and staff. Sometimes they can split up your dosage. I think the most common is a 40 milligram tablet, nice round yellow one. And maybe split it up into 220s, morning and evening, but maybe not too late in the evening that you're waking up late at night to go pee and tinkle. I know it's very inconvenient during sleep to go get up and pee and rush out of bed, knock over your lamp, wake up your significant other, and maybe crash down the hallway, go to the bathroom.
Oh dear.
So, yeah.
Perfect. So MRAs, these are not necessarily tolerated by our heart failure patients. They do affect your kidneys, and so we really have to keep a close eye on them. And but they do prevent sodium and fluid retention. So if you're able to be on them, most of our heart failure physicians or nurse practitioners will try to keep you on them, because there is a benefit with being on them. Like I said, some of the side effects are increased potassium. You do get dizzy and lightheaded and dehydration. It's kind of like a weak, we call it a weak diuretic. Sunny, what has been your experience with this medication?
I believe this one would be the spironolactone that I take. I was on digoxin very early, but spironolactone, I took it combined with my Lasix, and it helped with kind of retaining, your nutrients that you would lose with your Lasix. So I know I take normally I would take potassium twice a day. So now with combined with spironolactone, I think I take just one tablet of that potassium or Cader as it's known in a day. So I think it's been very important to take it combined with Lasix in my medication regimen.
Perfect. So back to the heart zones. This is your personal action plan. The heart zones we've talked about. And then if you're somebody that likes to write down your information on your personal action plan, that's great. We really encourage that, encourage tracking of how you're feeling and how you're doing, so that you can manage your heart failure. And when, like what Sunny said, when you go to the doctor, make sure you tell them, or make sure you tell your nurse practitioner how you've been feeling, what you feel is changing, and then you can work together with them to change your medication or exercise regime to best suit your needs at the time. So we all know there's barriers for self-management, and Sunny, I'm going to get you to speak to them because you are the patient that's living this day to day. And Gord and I talk to our patients about what's important and what they should be doing, but it's your reality. So we're really interested in hearing your story and what you do and what your solutions are.
There's so many barriers, and it's gonna be difficult for me to kind of highlight them all in a short amount of time. But I know the biggest one that stood out to me were like the everyday of, especially being diagnosed and being from healthy to this. And in that time, I mean, myself in my situation, I was living with my family at the time. I was 18, so I think it's important for your family to be involved. And initially, I had my parents and come along with appointments so that they could understand, because you know, the kind of whisper game, you know, the doctor's telling me something, I tell home, and they're probably not going to comprehend. I'm going to lose some of it. So I found it was important to have, you know, if you're young like me, your parents or your significant other, anybody else who can help support, come along for appointments and help understand. And even for diet and meals, if your family can kind of you know, go along with the low sodium diet, and in your dying as a family, you can share the same healthy heart meals together. And you know, and when it comes to even just like your social life and everything, I know that quality of life is a big issue in this. um, and not having that quality of life can sometimes bring your mood down and get you depressed. And so taking advantage of the kind of the mental health support and the resources uh, in your clinic, it's just to speak up and ask for it and bring it up in your appointments, not to be shy. I know I definitely took advantage of those resources, and I spoke to, you know, our clinical psychologists, psychiatrists, and even sometimes even you know, sometimes it can help with any peer mentoring and introduce you to other heart failure patients. So I think that those are the key things that kind of help overcome my barriers with heart failure, and helping me do my self-management.
Great. So do you want to speak to sort of the overarching pieces on this slide, and some of the key things that you as a patient and the other patients in this session should really think about when they're self-managing their heart failure?
To be blunt, if there are any things like that you're doing in your daily life, and like you're used to having that everyday, you know, beer clock after work, you're smoking, and any habits that, you know, everybody has the common sense to know what's not good for you. Um, I would highly encourage to quit if you can, and control, um, and just have compliance with your clinic. I know that for me to be in the position I am today, and now 18 years and being 6 years post transplant, and I'm here healthy and sitting right in front of you guys today to present. It all came from just listening to my clinic and all the help that they provided me, and all, and that's why I'm here. So I would just kind of encourage that, being active, following the diets, following the medications, and keeping in contact. I know sometimes in the outside world, or from relatives and friends, they're going to say, "Hey, this is a really good natural remedy that you can take," or "Here, why don't you try these vitamins?" I don't take anything. I don't follow any of your advice until I get confirmation from my GP or my clinic. And just keeping engaged physically, watching your diet. And I think now, in especially HeartLife now has opened up such a big, vast network of other HeartLife patients that we can interact with and meet with, and sharing all their experiences and advice and tips. I think those are just the big tips I would recommend to help kind of manage and just pick healthier lifestyle choices. It's better, it's easier said than done.
Yeah.
But that's just I'm a living example. And exactly, and then remember taking your vaccinations. I got my vaccination done 2 weeks ago, and I know some people might be worried about them. Like it's been 2 weeks, and I had a sore arm for a couple of days, and I'm here. It's fine, so I'd recommend it. And the flu vaccine, I'm sure a lot of the heart failure patients are already taking that, and same with the COVID vaccine. Just take it and listen to your professionals.
Hey, good advice. I like what you said about the HeartLife Foundation. And we meet every Wednesday on Zoom with heart failure patients across the country. And what I hear from them all the time is how important it is to meet and talk with people that are experiencing the same things in life. And they talk a lot about the psychological sort of benefit of it. And so hopefully the people that are watching this session join our HeartLife sessions every Wednesday they're 2:00 BC time. And we're happy to have people there. So about resources, these are some websites where you can go on and get a lot of really good evidence-based quality heart failure self-management resources. And then Gord is recommending the Cardiac College. They've got a lot of really good things around cardiac rehab. So I want to thank everybody for coming to this session. I want to thank my co-presenter, Gord and Sunny. It's been great. And so we're going to open it up for questions. And we also want to thank our sponsors for this session and for the whole day, Boehringer, Lilly, Bayer, AstraZeneca, Medtronic, Novartis, and Servier. So thank you to them too. And to our Q&A.